So for those of you that I am new to, and I don't think it's that many, I'm going to tell you a little bit about myself. Who am I and why am I standing there with a apple in one hand and a syringe in the other? And I think the point I'm trying to make here is that as a physician, as a doctor who utilizes the best that our advanced technological healthcare system has to offer, at the same time, I realize that the fundamentals are in diet, lifestyle, nutrition, that without those fundamentals, there is no real health. Now, how did I get here and why am I here doing this webinar and all your other doctors are, there with their little online visits and so forth. So I got on this journey for a personal reason. I was a good student all along, got into medical school, did just fine. But interestingly enough, I was the dummy for everyone to learn to locate their thyroid gland, right here in the lower neck. Why was that? Mine was so prominent that the professor would use me as the live model. Okay. So I thought, geez, there has to be something wrong. I went to the doctor, in medical school, we don't know a heck of a lot yet. We went to the doctor and the doctors told me, your thyroid is borderline. Nothing needs to be done. Come back in 6 to 12 months. Like, okay, came back in 6 to 12 months. Life's going on, no problem. Told the same thing again. Okay, so after graduating from medical school, which I did and did very well, I got married and then I started a residency program. And now everything changed. My energy level became so bad that every step I took required a sheer act of willpower. My career was totally at risk of ending. They were actively looking to replace me. My husband was looking to replace me. Nothing I could do to keep myself going. And I said, wait a minute. Maybe I have a thyroid problem. Maybe now I do. So I went back in. And again, what was I told? Your thyroid is borderline. No treatment is necessary. You're having a hard time with residency because residency is hard. It's harder than medical school, especially for women. Maybe you should think about another career, like public health. Jeez, I'm thinking to myself, public health? That's for people that didn't get into medical school. I was first in my class. Fortunately, somebody suggested I get a second opinion, and I did. And that doctor started me on Synthroid because he said, well, you seem to be having all the symptoms, so let's do a therapeutic trial. So I felt a little better, it's just trying to come back to life. And that only lasted a couple of months. And then started to drag again. I couldn't keep up with my duties as a surgical resident. I had no energy when I got home from the hospital. I just totally beat. Again, I thought, geez, am I going to make it at this? I was in one of the most challenging residencies there is in the country. Head and neck surgery at the Johns Hopkins Hospital. But I really, really wanted to do this. This was my life's dream. It was my passion. I got lucky. One of my medical school professors came to the rescue. He had just developed a whole new way of looking at the thyroid. And that saved me. He taught me how to optimize my thyroid hormone levels. And whoa, before I knew it, I was leading the pack of residents on 5 a.m. rounds. So everything turned around. And that really gave me the opportunity to reach my dream, to stay married to my husband and really, really thrive.